And now I want to pass it over to Rebekah for some closing remarks.
Hello, everyone. I'm Dr. Rebekah Gee, and I serve on the Culture of Health Advisory Group. Wanted to have a lot of people to thank today, especially Victor Zhao, the president of the National Academies, who has really leaned in on health equity and led a variety of projects, including this one, helped drive them. The goal of this, of course, is to mobilize evidence, deepen understanding, identify strategies to create and sustain conditions that support equitable good health for all Americans. And we heard so much about this today. And so we're achieving the mission through what we're talking about. I also wanted to thank the planning committee, Odo Kerr, Angela Diaz, Velma McBride Murray, Donald Warren. Thank you so much for their planning and for the staff at the National Academies whose hard work made this a successful day. My background, I'm a member of the National Academies. I'm a practicing gynecologist and former health secretary for Louisiana, where I led the expansion of Medicaid and founded the first Office of Health Equity in a Deep South Health Department. Also recently founded a company called Nest Health, which is a Medicaid primary care company focused on Medicaid families with young children. And through a community health worker workforce, meets people where they are. It's based on the NUCA system of care from the South Central Foundation in Alaska, which was built by and for Alaska Native peoples, and much of the value set that I hope to spread and share with this company and has been part of the NUCA system. It has been discussed today, bringing care home, especially for individuals, and thinking of families as units, not as distinct individuals, but as an organic unit that all have needs that can be met and addressed in so much better way than what we're doing. I did it because I didn't see the for-profit sector, replicating the home visiting models or other gold standard public health models that I know work. And I'm tired of seeing the chasm between what we know works for communities and what is funded for communities. And I'm trying to build a bridge because money is power. And until we change how we distribute it, we don't change the power. Today, we heard a lot about power distribution. We talked about community power. We talked about how communities have so much more richness than is often recognized, that we blame individuals rather than institutions for issues, that we ought to look at a strengths model, not a deficit model, not prejudge. Also, in terms of solutions, that we don't want to create cranks that don't turn anything. We don't want to count, not connect the dots. What we want to do is empower decision makers and thought leaders to communicate, to build power, and buy-in with, and nothing about me without me. But to create the health systems change, I believe we need to have not a scarcity mindset, but one that includes more. We need more seats at the table. We need more steering wheels to drive the car, more sharing of power and ideas. And then and only then will the system change. When we share the power, we redistribute the power, and we change our own models. So I challenge each of you, as I've challenged the national members of the National Academy and others, to look into your own organizations, your own power structures, as Gandhi would say, question and be how we wish to be the change we want to see in the world. And it's wonderful to have the National Academies engaged in this work, one that includes over 2,000 members, many of whom are some of the most powerful individuals in this country in healthcare, and absolutely represent those who could make the change that we're talking about seeing in the world. Tomorrow, we're going to get a little bit more concrete about additional interventions and hopes and dreams we have for creating equity. It's going to be a fantastic panel that starts at noon Eastern. I thank all of you for participating today, and we very much look forward to seeing you tomorrow. With that, I'll hand it off to staff if they have any last comments. If you don't take the baton, then just thank you, and everyone stay happy and healthy. It was wonderful to be with you today.